Thank you.
Hey guys, it's Dr. April Lynch coming to you from Bluegrass Veterinary Hospital here in lovely Gallatin, Tennessee. And today I'd like to discuss some important information that I think will help enhance your bond with your veterinary professional and also your bond with your pet. If you're a pet owner or interested in all things veterinary medicine, maybe thinking about going to veterinary school, please like this video and subscribe to our channel so you won't miss any upcoming videos. Today I want to talk about what to expect at your first veterinary visit, whether it's with a new pet or you've moved to a different area and you have to switch to a new veterinarian. And the ideal time to schedule that visit, whether your pet is very young or very old, is within 2 weeks of obtaining a new pet or of moving to a new location. Very important to establish a baseline relationship and for us to establish the baseline health of your pet. So we call these visits a wellness visit because your pet is well and we were just trying to examine them and make sure that they are healthy. It's not a sick visit. So the purpose of these visits would be to establish a relationship with your veterinarian, which allows us then to make recommendations and prescribe medication legally because we have examined your pet. We also want to, in the very young animals, look for any birth defects, parasites, any signs of general unwellness, diet, preventatives, and any behavioral problems that your pet may be having. So the general flow of your wellness visit should be that you are greeted by a staff member when you walk in the door, usually the receptionist or the CSR. You may have a short wait time in the waiting room depending upon how busy the practice is at that particular day and time. And then you should be ushered into a private room by one of our veterinary technicians or assistants, and they will take what we call the vitals or the baseline health information such as heart rate, respiratory rate, weight, and temperature of your pet. As a doctor, I need this information before I come into the room to know what kind of recommendations and what might be going on with your pet, because sometimes it will change the course of the visit. If a puppy or a kitten is running a fever but is there for their vaccinations, then oftentimes as a doctor, I would cancel the vaccine appointment and we would instead turn it into a sick visit and figure out maybe why the animal is sick, why they're running a fever, what they might need as far as medications, and reschedule the vaccines for a later time when the animal is healthy so that they will respond appropriately to their vaccines. And then it's time to see the doctor. So when I walk into the room, I typically will introduce myself to the owner and then introduce myself to the patient. It's important that they get a moment to kind of sniff me out and make sure that I'm an okay person and they're not too scared. And generally, I would like to observe the behavior of the pet from across the room to make sure, is this puppy or kitten doing what I would expect them to do in this environment? Because if not, that could be a sign that something isn't quite right. Then I will look at the history and the vitals that the technician has obtained for your pet, and then I like to do a head to tail, very systematic examination so that I make sure I don't miss any parts of the pet. And if I find anything out of the ordinary, then we will discuss that and we can make recommendations based upon our findings. And just as a warning, when you come into the veterinarian, we are going to take your pet's temperature, and unlike in human medicine where we have this nice little forehead scanner, is not accurate in pets because they're covered in hair. So we take a rectal temperature and they usually don't mind nearly as much as the owner does. This is Sadie and she's such a good girl. Takes about 15 seconds and then you're done. Okay. And next we get her pulse, which is her heart rate, usually through a stethoscope. We can also just feel the pulse and we will count the beats for about 15 seconds and figure out what the heart rate is to make sure that it's normal. Her heart sounds great, beating quite fast. And then we will count the respiratory rate, which is often the hardest part for us to learn when we're doing things in the practice because you can really only see it in the flank, and if the animal's a little bit on the heavy side, it's really hard to figure that out. So we watch the respiratory rate and count that. Right now. Hers would be pant. Really can't count it. And then the doctor will do their head to tail exam of your pet. Oh, she tried to eat my cone. She says. Again, please like and subscribe so that you can catch all of our upcoming videos and content, which are going to be similar and also progressional from what we had today. If you have a question about today's content or any kind of question about your pet, We will do our best to answer it. Drop it in the comments section and we may feature it on an upcoming video, which would be super exciting. And I looked down too quickly.